Welcome back to the Big Vet Unleashed, the podcast that cuts through the red tape so you can actually use your VA benefits the way they were meant to be used. If you caught our last episode, we covered the VA 72-hour rule for emergency care and how missing the deadline can cost you thousands of dollars. Today, we're going to take it a step further. We're going to be talking about Community Care Network, or CCN. We're going to break down who can use it, when not to use it, how long your referrals last, how to get one, and how to steer clear of the common traps that trip veterans up when using the Community Care Network. And like always, we're going to include our veteran reference guide that you can download, and it's going to have all the steps for you, phone numbers, links, everything's going to be built into that. So if you hear me mention something, you don't have to write it down. It's going to be included in the episode in our veteran reference guide. All right, we're talking about the Community Care Network. What is it, and how does it benefit you? How can you use it? The CCN, it's a VA-approved bridge so that you can go out in town and get private medical care. If the VA doesn't have the care, they can't see you in time, they don't have that specialty, the VA is contracted with providers out in town, and it gives you another alternative to VA care. So you can see these non-VA doctors, sometimes you can see them quicker than the VA doc, or you might see somebody that's not available at your local VA, or if the VA is too far away from you, you can utilize the CCN network. But before you can use it, there's requirements that you're going to have to fulfill. You're going to have to get a referral. You're going to have to get an authorization. So you can't just go out in town and start seeing doctors that you want to see without going through the process. As veterans, we know there's always a process to everything. So we're going to talk about how you're going to do that, where you can see your referral, your authorization, make sure everything's approved before you go out to that doctor and get stuck with a bill if it's not approved. Before you go see Community Care Network doctor, you have to get VA approval. VA has a whole process for it. We're going to talk about that. And they're going to talk about how you as a veteran or a family member can log on to one of the two websites, either TriWest or the Optum network. And you can look at your referrals and authorizations. You can see who they're for and how long they're good for. That's important. And again, that's going to be in the veteran reference guide. Again, the VA is offering this service. It's not a free-for-all. It's designed to fill gaps if the VA can't get you in on time, or if the VA doesn't have that specialty, or if you live out in a rural area and you just can't get in to see one of the doctors. There's certain requirements for mileage. You can get out there and see a CCN doctor if there's one local to you. How do we use our CCN benefits? Before you can even use it, you have to be enrolled in VA healthcare. You have to be eligible for VA benefits. You have to be in the system, and you have to try to get scheduled and work with the local VA hospital or clinic to get in. And if they can't fit you in, then you could start looking at CCN alternatives. What are some of the requirements that you have to meet before you can see a CCN doctor? So one of them, the VA doesn't offer the service you need. Think maternity care, a specialty that maybe they don't have, a neurosurgeon, or in vitro care, something that the VA doesn't offer, then you would be qualified to go out in town. You live in a state or territory without a full service VA hospital. You live somewhere and there's not a full service hospital, or there's not a VA clinic nearby, that's going to be a qualifying factor. You were grandfathered under the 40-mile rule back in 2018. If you lived outside 40 miles from the nearest VA, you could go out and get Community Care Network somewhere closer. Or your drive time or wait time's too long. So more than 30 minutes for primary or mental health, or 60 minutes for specialty care. And they'll break that down and they'll let you know if you qualify. Another one, your VA doctor and you agree it's in your best medical interest to go outside. That one's kind of rare. You're not going to get a lot of doctors that are going to agree to that. I just went through this with one of my physicians, one of my specialty doctors, and they insisted that I see them first, and they would not do a referral out in town because I didn't meet any of the requirements, and they weren't going to just refer me. That's a really hard one to get, but you may have a doctor that decides there's better specialty care out in town than they can offer. Or the VA facility doesn't meet certain quality standards for the care you need. Again, do they have the facilities and the equipment and specialists there to take care of you? And one of the big ones, if they can get you in within 28 days, then you can go out and see CCN. If you call and they can't see you for 6 months, you can request to go out in town to see a Community Care Network doctor. I will tell you, I've been in the VA system for, 14 years. It does all of my primary care, specialty care, all my surgeries. I do everything at the VA. I have a great VA here in Tucson. And I'll tell you, in the last year to 2 years, the VA has began pushing back on community care referrals. When I call and I say, nope, that's 90 days out, let's refer me to community care, those schedulers have been pushing back and saying, we don't need to refer you 60 days, that's not too long. And so I think there's some training going on to try to get you to stay within the VA network because it is more cost effective for the VA. But I remind them, if you can't see me within 28 days, then you need to refer me out in town. And we'll talk a little bit more about when that's beneficial and when it's not. We'll talk about advocating for earlier appointments and how you may be able to get in sooner than what their initial appointment is offering. So how long it takes them to get you scheduled is a qualifying factor for CCN. When are you going to use CCN? When's it convenient for you or the physician? We want to look at some things. We're obviously concerned about your health. We want to make sure that you're getting seen. If it's just a follow-up visit or if it's not impacting your quality of life, then you might be able to wait 3 or 4 months or 5 months. Or if you're, outside that mileage range, but you go near that place every month or so, then you may be able to schedule and not use CCN benefits. So you have to decide how important and how urgent and how medically concerning your visit is, whether you want to push CCN benefits or not. A lot of times the VA won't be able to see you within 28 days, 29 days. The first option is CCN, but I'll explain a little bit later why sometimes going out in town can take just as long as being seen at the VA. Discuss with your provider, discuss with your scheduler or your primary care doctor, and decide if CCN is going to be a benefit that you want to use and if it's worth it. Sometimes it's not worth it. What's the process? How do we go through this as a veteran? So you want to talk to your provider. A lot of times if you're getting a referral from your primary care to a specialty care, so I go see my doctor, she says, hey, you need to go see cardiology. I'm not going to talk to the cardiologist. I'm going to talk to the scheduler, and they're going to call me and say, hey, we have our earliest appointment is 9 months out. And I may say, well, that's not acceptable. I need you to find something sooner. Let's say they say, cool, we're going to refer you out in town. I'm going to send you out to CCN referral, give you a little bit of breakdown of how the process works. They're going to submit the referral, and it's going to go through the process at the VA to get approved. And they'll tell you it takes about 2 weeks, depending on your location. Mine, I've had them go through as soon as 3 to 5 days. The VA, it's going to send it to the referral department. And in 3 to 5 days, they're going to call you and they're going to say, hey, we have a referral for you. What part of town do you live in? We're going to send you out to a cardiologist and we want to schedule someone close to you. So they're going to take that referral and they're going to send it out to that local specialist that's by where you live. They're going to try to find something more convenient for you. And they're going to send that to the physician. Now, the physician group, their scheduler has to get you on the books. That doctor's office is going to call you and they're going to try to get you scheduled. That could take another 5 to 7 days for them to call you. And I've had it happen pretty quick. I've had the referral and that call all take place within about 7 business days. Now, remember, when I'm going out in town, that physician doesn't have an obligation to see me within a certain window of time. They already have other patients. While we're a priority for the VA, for civilian physicians, we might not be as high of a priority as we'd like. So when they call to schedule me, I could get in really quick. I've had really good luck here where I'm at in Tucson. I think they prioritize veterans a little bit, but I've also had referrals out in town where they couldn't see me for 60 to 90 days because they were backed up. There was maybe 2 or 3 of those specialties in town and they're backlogged. They're going to call me and schedule me, and I have to make a decision. If that doctor can't see me for 60 days and the VA couldn't see me for 70, and the quality of care at the VA that I go to is really good, I may want to just wait and call the VA back and say, hey, cancel my CCN referral. Let me go see the VA doctor, because the window is about the same, 60, 70 days, 90 days, whatever it is. And I prefer all my medical records be at the VA, all localized, see the same doctors. It just makes it easier for me. So you'll have to decide, is it worth it? Now, if the VA can't see me till next year, 12 months out, and the community care provider can see me in 2 months, that's obvious, right? I'm going to go out and see that doctor. So you're going to have to make that decision and make that choice if it's worth it for you. I will tell you, just because you're going out in town doesn't mean you're going to get seen in 3 days, 5 days. There's a process, and just the referral process and the scheduling process for the physician could be about 3 weeks before you even get an appointment, phone call to get scheduled. Just giving you a breakdown of how that's going to work. So you're going to schedule your appointment. And what you do, you'll go see your physician out in town. By law, they have to share all the medical records with the VA. Any imaging you have, anything they do, they're going to share that with the VA. And if they order any prescriptions, they can send it to the local pharmacy and the VA pick it up, or we'll pick it up, or they'll send it to the VA if it's going to be a continuous prescription, and the VA will just get you on their mail order program and start mailing it to you. I will say if you use community care, outside care, sometimes there'll be discrepancy in your medical records. The physicians can't see them, they didn't submit them. You may go see your doctor and they don't have access to those records or they weren't submitted on time. So it is one thing to look out for. I always have a problem with outside imaging being sent to the doctor. I always have to go get my imaging records, take them to the VA medical record, and have them uploaded. While there's some convenience, there's also some drawbacks. It's not a perfect system. Anything you have done out in town, you want to make sure you have a referral for it and you have the authorization. We're going to talk about that and how you can view your authorization and referral to make sure you're covered. VA is your only care, your only coverage you have, only insurance, let's just say insurance. Then you want to make sure it's picked up. The doctor won't see you without the authorization referral. They're pretty quick to say, hey, we don't have it on file. We can't see. If you have other insurance, let's say your wife works and you work and you have other healthcare coverage, or you're older and you have Medicare, sometimes a provider will see you and they're just going to charge that other insurance. But remember, that insurance is going to have a deductible. They may have a copay, and now you're going to be paying out of pocket. And if you don't know that you don't have a referral or authorization, you may go there, think everything's covered, and then you come to find out, oh, hey, I owe $600 for this visit, but the VA should have covered it. So we're going to talk about how you don't get caught in that trap. Working in healthcare, I've seen a lot of veterans come in, they're getting bills for deductibles, and they're complaining because they say, hey, I have VA benefits. Why am I paying for this? Well, the office that they went to didn't do their job, didn't do their due diligence. And now that veteran got a bill because they switched from VA coverage over to other health insurance because they're going to do what they have to do to get you scheduled. So we want to make sure you know how to check that, have your family check it for you so you don't get stuck with the bill when you're expecting the VA to pay. So we talked about VA referrals and authorizations, and I'll walk you through the process. I see VA doctors all the time. I see neurologists for migraines. Recently, I had been seeing a neurologist out in town. The VA wouldn't get me in time. So I've been seeing a neurologist out in town for 2 years. And they had been on the ball. They were getting referrals on time. Everything was good. I was seeing the doctor. Things were going great. And then they got some new office staff in and they started dropping the ball on my referrals. And I know how the system works. So I would call and check, hey, can you get my referral updated? The VA will offer an emergency referral authorization, but they'll only do it once or twice. I get my referral, I call them, and it's expired. I tell them, make sure you get it. If you need my help, let me know, and I'll talk to the VA. So another month goes by, they still don't have it done. They promise me it's going to get done. Another month goes by, another month goes by. By the third month, though, I really need to see the doctor, and they don't have my referral updated. They don't have an authorization in the system. At that point, they won't see me because that's the only insurance I have, and I'm not going to pay out of pocket. They should have taken care of this with the VA. So there's a partnership between your doctor out in town and the VA. They have to be working together. Your doctor's office has to be getting that referral and authorization. You need to make sure it's on file. You need to make sure it's updated. If I had other insurance, they probably would have seen me and billed my other insurance. Referrals, the VA just extended the referrals for specialty care to a year. It used to be 6 months. That's good news for us because we don't have to follow up every 6 months. We're just going to follow up once a year. We get that referral. It's going to be good for a year for care, prescriptions, doctor's visits, all that stuff. Any imagery, it's all going to be covered under that. So radiology visits and all of that's going to be covered under that 1 year. How do you as a veteran know if you have a referral and authorization on file? You can call the office and the front office person and say, oh, yep, you're covered. You're great. We got everything. They're not looking at your record or they're looking at the wrong record. So as a veteran, you can log in to TriWest if you're on the West Coast. If you're on the East Coast, it's going to be Optum Community Care, so Optum CCN. And you can log in, create an online profile, and go into either of their portals. And if you want to see which region you're in, you can just go to the VA CCN network. There's a bunch of regions out there, but it's broken up pretty much West Coast, East Coast. Find out where you're at, and you can log in. In creating the tip sheets or the veteran reference guides for you, I went in and I created an account for Optum and one for TriWest. So you can create an account in either system. And you can see what your referrals are. And it's going to list your doctor, the referral, the start date, the end date. It's going to give you the authorization number. And if you see that you're going out in town to see a dermatologist and you see everything's in there, then you're good to go. you can confirm with the doctor's office and say, hey, here's my authorization number. Is that the same one you have on file? On the veteran reference guide, we're going to include, it's going to show you how to sign up step by step. It's going to walk you through how to sign up and what to look for. You're not medical specialists or billing folks. So we're going to walk you through how to do that and what to look for to make sure you're covered. Again, you can ask that doctor's office and they should take care of you. But I will always say you have to advocate for yourself, your family members, advocate for your veterans. If you expect the facility, the hospital, the doctor's office to do it, they're busy. Nobody's going to care about your care as much as you do. So make sure that you create a portal, create an account on the portal, and follow your own healthcare. If you're a family member, you can log in with them and you can check their benefits. It becomes a lot to track if you're using CCN because, again, you're going to be going out in town. You're going to have different appointments and different locations to go to. We want to make sure we're all covered with those benefits. What are some things to avoid? What are some things you need to look out for as a veteran? Going to a non-VA provider without a referral. So if you go there, it becomes really important if you don't have insurance, or if you have insurance, but you don't have the authorization. Sometimes the doctor will still see you. You have Medicare, they'll see you because they know they can charge Medicare, but you're going to have a deductible. So we want to make sure we have the referral on file. When you get the CCN referral, a lot of times the VA wants you to notify them that referral phone call. They'll ask you, hey, can you let us know when you scheduled your appointment? And they can see it in the system. As someone who's used it, they'll call me sometimes in 30 days and say, hey, we noticed you haven't scheduled your appointment. Is everything okay? Do you need our help? And I'll say, oh, sorry, I scheduled it. I just forgot to tell you. You may call the VA back to let them know they scheduled. If enough time goes by and you haven't scheduled your appointment, they will cancel the referral. I've had them do that to me. I couldn't get in for 3 months and I didn't call the VA to let them know, and they canceled my referral and I had to get a new one. Wasn't a big deal, but it did add some time to me seeing the doctor. Letting your authorization expire before follow-up care. Don't let your authorization expire. You don't have to do anything. You just have to remind the physician's office that, hey, my authorization is going to expire in 60 days. Can you go ahead and make sure you extend it? They should do it. Again, having experience, you have to follow up and you have to make sure they're doing it. If they're not, ask to escalate and speak to the business manager for that doctor to make sure they're doing it. That neurologist who wasn't taking care of me, I fired him. Hey, you're fired. You're not doing your job. You're done. If you're not happy with that outside provider, you can escalate respectfully at the office. You can make sure they're getting that referral. But if they're not, it's going to impact your care. It's going to impact your prescriptions. And the VA can't do anything because you're seeing an outside doctor for that specialty care. So you want to follow up. You want to have a good relationship with them. But if they're not meeting your needs as a veteran, as a patient, fire them, get a new doctor, or see if the VA can squeeze you in. Again, I prefer to have all my care at the VA. So if they can get you in, sometimes that's the best option. I know we all have different experiences with the VA. The other thing, if you're out in town seeing a CCN provider, sometimes veterans think, oh, I can get all my care out in town. So we did talk about in the first episode, we talked about going out for ER visits. That's different. That's emergency care. The care we're talking about now isn't emergency care. It is scheduled care that is not an emergency or urgent. You can't just go see anybody you want because you're in the system. You have to get a referral for each specialty. If you've got to see cardiology, you need a referral for them. If you need to see dermatology, you need to get a referral for them. Each one has to have its own referral, and you'll see each of those referrals in the portal. You'll be able to track it. You'll see the authorizations. Everything's going to be in there. And again, you can print that out, put it on your refrigerator, give it to a family member so they can help you track that. One thing I will recommend, reminding your doctor, hey, are you sending all the documentation back to the VA? Are you sending all my records back over there so that they have it? And most of the doctors are really good. We have electronic health records, giving the ability to share, forwarding notes and all the results over there. But you want that in the system because if you go in for surgery or if you go in for other specialty care, there may be some things that you want to make sure all the doctors that are in your care can see and know about. Maybe there's medications or things that you shouldn't be doing or should be doing. And we want those doctors to be sharing all the notes. Make sure they're sending it over. They know it's part of the contract. I haven't had too many issues with that, but you have to advocate for yourself. You have to make sure they're doing it. And after every visit, you can just ask, hey, is all this over there? And as veterans, you guys can go into va.gov, My Health Benefits, and you can look at those medical records yourself and just see if you saw Dr. Smith out in town, are his notes showing up in your VA medical records? And if they are, great. You can ask your primary care doctor, hey, are they sending the notes over? Make sure those medical records are in there so you have good communication between the physicians and everybody can see what you're going through. The veteran reference guide, we're going to talk about how you guys can go in portal, either one, look at your benefits, make sure your authorization's on file. There's phone numbers on there that you can call for either Optum, which is our East Coast provider, or TriWest, which is our West Coast third-party administrator. You can give them a call and ask them, hey, I have a cardiology appointment over referral. If you're not somebody who wants to create a online account, those are some things you can do. And again, that's all going to be included in that veteran reference guide. So as a veteran, when you're going to use your VA care, I just talked to a veteran the other day, and we were talking about getting care, getting appointments made. And he was talking about how they couldn't see him for 6 months, and he just accepted that. And I was explaining to him, well, you need to advocate. You need to push them sometimes. Some tips and tricks here. When you call the VA, if they can't see you, they're going to give you the first available appointment in their scheduling system. If it's 4 months out and you're suffering from, let's say, chronic migraines, and this just happened to me recently, I went from CCN to the VA. I called and they said, well, we could see you in 4 months. And I said, well, that doesn't work for me. Chronic migraines, you got to see me sooner. Well, the earliest appointment we have is December. And I said, well, that doesn't work. You can send me back out in town, but I'm coming to you because I had a bad experience out in town. What can you do? They look in the system. Well, we can see you in 60 days. Have conversation with them. Don't be rude. Don't be disrespectful. They're doing their best. They have a protocol to follow, but they can get you scheduled probably sooner if they know it's something that's urgent, if it's affecting quality of life. Sometimes it can, sometimes it can't. But you want to let them know, hey, is there anything I can do to get seen sooner? And I always joke around with the schedulers, hey, I'll bring you Starbucks or, buy you guys donuts or whatever. Again, it's not something you have to do, but I'll joke around and let them know, hey, I'd really like to get seen sooner. And they always accommodate me. It may not be 20 days from now, maybe 60, but that's better than 90. Ask them, hey, is there any way I can be put on a wait list? I can be there within 45 minutes from the time you call me. If somebody cancels, can you put me on it? A lot of the VA hospitals don't have wait lists. They don't have automatic scheduling where somebody cancels and they put the next person on. But if you're nice, you're cool, sometimes they'll say, you know what, I'll take your name down. If we have an opening, I'll give you a call or we'll shoot you an email. So I said, hey, can I be put on any wait list? This is affecting quality of life. I'd love to be seen. And she goes, well, you know what? We have a Saturday clinic. They might be able to see you in 2 weeks. Well, I went from 90 days to 60 days now to 2 weeks. And I said, let's do it. I'll cancel any plans I have. I'll be seen on Saturday, whatever time. So 2 days later, the physician calls me and says, hey, we scheduled you for 2 on Saturday, but can you come in at 4:30? I'll see you at the end of the day. Yep, it's urgent enough for me. I'll get to see him. So I went from 90 days to 60 days to 2 weeks to 7 days. And I was able to get in to see them. They had a Saturday clinic because they were overbooked and they're trying to get patients in. And I was able to see the doctor. Had I accepted the first visit that they offered me, I'd have been 90 days out. But as a veteran, be professional, be polite, be courteous, use your charm. If you don't have charm, have one of your family members help you out. Talk to the scheduler and see if there's something they can do for you to get you in sooner. If they can, and a community care option is available, look at what the VA was offering you. If it's 90 days and the doctor out in town could see you in 80, that may not be worth the headache of being out of town. And for you, it might be worth it because that doctor's office is a mile down the road and the VA is 24 miles down the road. And it's just a better situation for you. But ask if they have sooner appointments. Can they get you in? Plead your case. Now, if it's a follow-up or if it's something that's not urgent and you can wait, then go ahead and wait. But if it's affecting your quality of life, it involves pain, you're not feeling good, you feel that it's more urgent, but not urgent enough to go to the emergency room, then talk to the scheduler and see if they can get you in. Again, I've had friends that work at the VA and I've gone through the process. Sometimes they don't have the automated. They'll take your name down and say, hey, I'm going to call. Something opens up and I'm going to get this veteran in because they sound like they really need it. You got to play the game. You got to use a little bit of salesmanship. I thought all veterans knew that. Having worked in healthcare, I just assumed that a lot of people know that. But talking to my friend, he was like, I didn't know I could do that. Advocate for yourselves, advocate for your family member, try to get in sooner if you can, and see if you can avoid CCN at all, so you can keep all your care within the VA. CCN can be a game changer for getting care outside the VA, for getting care sooner. But remember, you have to follow the process. You have to be eligible, got to be in the VA system, got to have a referral, follow the timelines, and then make sure that when you're going out in town, it's all covered, and you're going to follow up with that on the portal or by making a phone call. At the end of this, when you're done listening, you're going to download that free veteran reference guide, download that, print it, and you're going to go ahead and go create that account for you. If you plan on using outside care, you can create an account without even having a referral. But that way it's set up. You have everything ready. If you do go out in town, you can see that referral as soon as it populates. You can be involved in your care and be able to advocate for yourself a little more. This falls in line with our VA emergency care. You're getting outside emergency care. What to do? This one is specialty care, but not an emergency. If you missed our emergency care episode, go back and listen to it. It's our first episode, and these two topics that go hand in hand. Thanks for tuning into the Big Vet Unleashed. I'm Aaron, reminding you, you earn these benefits, use them. Till the next time, stay safe, stay informed. And if this episode's helpful, share it with your family, friends, like, subscribe, follow us on your favorite podcast. Thank you.